We'll be talking about your colostomy irrigation. Specifically, our goals is for you to explain the purpose of irrigating the colostomy and then determine the equipment used and the procedure used for colostomy insertion or colostomy irrigation, I mean. Okay? Now, in this case, dear students, let's define first colostomy. When I say colostomy, your colostomy is a surgical opening to the colon by means of a stoma to allow drainage of bowel contents. Again, it is a surgical opening to your colon by means of a stoma. When I say stoma, it's an opening to allow for the drainage of bowel contents. What do I mean by that? Okay, class, there might be colon cancer on the part of your patient, or your patient might have inflammatory bowel disorders wherein the doctor would need to cut, the surgeon would need to cut part of the intestines. Once the surgeon, dear students, has cut part of the intestine, we don't have a choice but we need to have an ostomy. Okay? We need to have a stoma for the stool to get out of the body. Okay, for example, if the descending colon here along with the rectum and anus has cancer, okay, the doctor needs to remove all of these parts. And then where will your stool be going out? So we need to have a colostomy. We need to have a stoma. So class, it's like a hole on your skin that is directly on your colon. When I say colon, that will be your large intestine. Okay, so there are different sites of your colostomy. Now come to look at this. If you can recall, what is the main function? What is the main function of your large intestine? What does it absorb, dear students? So class, take note that your colon is in charge of water absorption. That's the main function of your large intestine. Small intestine is actually intended for the absorption of nutrients. Your large intestine is actually intended for the absorption of fluids. Now, in this case, if I will be having a colostomy to my patient, what do you think would be the appearance? What do you think would be the appearance of the stool product? Would it be wet or dry? Would it be wet or dry?
Some cases wet, sir, and may gamay nga particles, sir.
Okay, so class, it says, classmate shares that it may be wet. Why do you think is it wet? Was the water already absorbed by the intestines or not yet?
Yes, sir.
So class, in the case of your colostomy, that's correct. Okay, your patient was not yet able to absorb the fluids from the body. Okay, or the fluids from the food product. Okay, now, if I would look at this diagram on colostomy, which do you think of the following stoma would have the most wet or the most watery discharges? Will it be the stoma in the ascending colon, transverse colon, descending colon, or sigmoid colon? Which is the most watery, you think? So that would be from your ascending colon. That would be from your ascending colon. So class, you would expect that the most watery discharge is from the ascending colon, going towards the transverse column, going towards the descending colon. So class, descending colon would be able already to assemble stools, okay, that are about to be formed. Okay, well-formed stools for that matter. Okay, take note of that. Now, what are the purposes of your colostomy? Class, your colostomy is intended to empty the colon of the gas, the mucus, and then the feces. It would also regulate the passage of fecal material. Now look at that, passage of fecal material. Now class, that means that at times your patient would feel uncomfortable doing it in the public because imagine, no, something is hanging on your abdomen. You have a bag there hanging on your abdomen, and then on that bag you have the fecal material. If that material, class, would go out to the air, other people would smell your fecal matter. That's why, class, some of these patients would not want to go out. Some of these patients would not want to socialize. Now, for that reason, we are doing your irrigation. But take note, nurses, usually in our setting, irrigation is done by physicians. Okay? In training hospitals, it is the residents who are doing it usually. So class, in our role as nurses, you only perform the irrigation if it is ordered by the doctor. Okay? Now, irrigation of the stoma. Class, the irrigation of the stoma, when I say irrigation, it's like you would want the gas to be out. You would want the stool to be out. You're getting them out. Class, so in your irrigation of the stoma, that results to less gas and retention of the irrigation solution. Again, it results to less gas and retention of the irrigation solution. So class, what time of the day should the colostomy be irrigated? It is actually, class, best for you to irrigate the colostomy depending on the schedule of the patient. What do I mean by that? If the patient would usually poop in the morning, it's best for you to irrigate the colostomy in the morning. It's also best, class, for the colostomy irrigation to be done inside the lavatory. It's best to be done inside your comfort room with the patient sitting there so that the patient will feel that as if he is just defecating, to mimic the natural environment, class, of defecation, in such a way that the patient will be able to establish a bowel schedule, in such a way that the patient will be able to establish a pooping schedule that will help him on his social life. Or else, class, your patient would poop any time of the day. Now, what are the equipment that we need to prepare? So you have your colostomy tray. Class, the colostomy tray in our case is usually retrieved in the central supply. In other institutions, the colostomy tray could be retrieved in the respective stock rooms of the station. So class, in our case, the colostomy tray is like this one, and then this is autoclaved. Okay, this is autoclaved. But in a first world setting and other institutions, class, they have pre-packed colostomy packs. In other words, it's already sterile. It's like a plastic, sterile. And then, class, it's by the time that you're done using it, you throw it out. Okay? Then you have your asepto syringe. This is your asepto syringe. Then you have your 4 packs of 4x4 sponges. And then you also have your glass bowl and then your sponge forceps. This is your sponge forceps. Then you have your prescribed amount of solution. Okay, class, the solution is usually at 101 degree Fahrenheit, which is equivalent to 40 degrees Celsius. Okay, 40 degrees Celsius. Then you have the bedpan, then you have the bath blanket, and then you have the rubber sheet, which is regular size. Okay, in case no, you're not familiar. So class, this is how a saline for irrigation would look like. If you can notice the tip there, okay, that we cut it off when we are about to do the irrigation. So class, if you can notice, the IV preparation is different from that of irrigation. Then this is your bedpan. Okay, your bath blanket is here. And then class, this is your rubber sheet. Okay, class, the rubber sheet is actually used so that the fluid or the moisture would not be going towards the linens and that your patient would not be wet after the procedure. Then you have your table protector. Usually it's color blue in our setting. Then you have your bedpan cover, class, your footstool, your colostomy bag. By the way, going back to the bedpan, class, is actually used again to mimic the natural environment for defecation. Okay, you have your treatment pad, you have your KY jelly, the rectal tube of desired size, and then the kidney basin for that matter. What will be the procedure? So check doctor's order. Again, do not do irrigation without doctor's order. Gather and prepare the equipment in the utility room. Explain the procedure to your patient and provide privacy. You need to bring your patient to the bedside. Then class, you need to change the top sheet with the bath blanket. Okay? That's the procedure. But class, in actual setting, what do we usually do? We use the top sheet in such a way that class, after the procedure, we replace the linens of the patient. Okay? Now, let the patient lie on his side and more to the edge of the bed. And then under the colostomy site, you place the rubber and the treatment pad for that matter. Then you arrange the equipment at the bedside within reach. And then you need to place the bedpan at the footstool near the bed and the kidney basin on top of the bed. Again, class, the bedpan is arranged at the footstool near the bed and the kidney basin on top of the bed. You might be thinking, why on the top the bed on the footstool? Class, it's a bedpan. The bedpan is the one receiving your urine. It's the one receiving your fecal matter. So class, that should be below the patient so that it will not be easily accessible if ever, class, for the purpose of infection. We don't want it to be spreading infection, but we want it to be within reach. Okay? One thing, future nurses, that you want to remember is that when you are working, all of the things that you should be needing should be within reach. Do not think that when you're doing a procedure, you always have an assistant. Most of the procedures that we are doing at the bedside, you don't need an assistant. That's why you are trained for that. Okay? You don't need an assistant. So that's why, class, you can see arrange equipment at bedside within reach. So when I say within reach, that should be within your arm reach. And you need to be careful that your hand should not be crossing. Okay, you need to be careful that your hands will not be crossing each other. It will not be crossing plus the shoulder of your, it should not be crossing across your abdomen so that you're preventing the spread of infection. Okay? Now, you need to remove the colostomy bag because we're doing your irrigation. Then you wash your hands and dry because after that it will be already a clean procedure. Then pour the solution into the bowl. Plus the solution will be used for irrigation. Then with one sponge or your gauze, hold the rectal tube and connect to the asepto syringe filled with the solution. Again, class, you pour the solution into the bowl. That will be your plain NSS with irrigation. After that, you get the solution and then place it inside your asepto syringe. For the solution to go inside your asepto syringe, you need first to press the blue, okay, the blue bulb there of your asepto syringe. You need to press it and then place it on the solution in such a way that it will suck the fluid to the inside of the syringe. Okay, it will have negative pressure for the fluid to go inside the syringe. Once the fluid is already inside the syringe, you need to attach the rectal tube. Now, you need to lubricate the rectal tube using KY jelly. So if your gloves is here, this is your KY jelly, you lubricate it. And then expel small amount of the solution to your kidney basin. The purpose of that is just for you to check if the tube will be okay. Then, introduce the rectal tube at about 3 to 4 inches through the stomach. Again, introduce the rectal tube at around 3 to 4 inches throughout the stomach. Then, introduce slowly the prescribed amount of the solution. If it is too much, give in divided doses, introducing 90 cc at a time. Okay? So class, what we did was to put some irrigation solution, to put some solution going towards the stomach of your patient. So what we did was to introduce the tube first and then introduce the amount of the solution slowly. Okay, and then if it is too much, give it in divided doses. Meaning, class, for example, if you would need to introduce more than 200 ml, okay, of irrigation solution, if that is ordered by the doctor, introduce it in increments of 90, 90, 90. Okay, 90, 90, 90 for that matter. Then, it's 90, 90, 20 in that case, since 200. Then have the kidney basin ready to catch up the return flow because we're doing irrigation. When I say irrigation, you let it in and then you pull it out. You let it in and then you pull it out. So class, you need to have a kidney basin ready to catch the return flow. And then you pour it to a pail once the kidney basin is already full. So you need to have a pail on standby. And then after the procedure, class, what you're expecting there, class, on the output, there may be some fecal matter on the output. There may be some gaseous substances that will be going towards the output. So after the procedure, when almost or all of the solution has come out, let the patient lie on his back. Clean the area around the colostomy with the cotton balls. Soak in the remaining solution in the bowl. Then dry the site with your 4x4 sponges. Class, when you are drying the site of your colostomy, okay, do not rub it like this. Okay, do not do it like that. Instead, class, you need to pat it dry. Pat it dry. If you will be rubbing it, you might be scratching some part of it, leading to injury. Don't want that to happen. Then you need to apply your new colostomy bag. And when you apply your new colostomy bag, you need to make sure, class, okay, that the colostomy bag would fit properly on the ostomy. Okay, class, if this is the whole of your ostomy, the colostomy bag is around that area. It is not too close, but it is not too far from the colostomy. Okay, so from the stoma, I mean. Then you remove the treatment pad and rubber sheet. You change the bath blanket with the top sheet and then make the patient comfortable. You need to take all equipment to the utility room, clean, dry, and then of course return to the proper places and you do your documentation. So basically, dear students, when I talk about irrigation, just as a recap, you prepare the fluid inside the asepto syringe, you attach the rectal tube. Then the rectal tube is attached towards the stoma of the patient, the colostomy of your patient. Then you insert the tube at around 3 to 4 inches, then push the fluid. After you have pushed all the fluid at 90-90 increments class, okay, what you would do is to pull it out also using your asepto syringe. Class, for you to pull it out, what you need to do, okay, detach first the asepto syringe and then push the blue button or push the blue bulb, attach it back, guys, and then that will give you a suction manner, or that would give you a sucking action towards the asepto syringe because of the negative pressure. And then that's it. You're done with your irrigation for that matter.